So, greetings folks, my name is Toby Lineaweaver, and today I want to talk about something that we are using here at Recovering Champions to help people that come in with co-occurring trauma and addiction. And sometimes my clients have referred to this as an algorithm because it's a bit of a formula or a self-assessment tool that helps them to know at any given time whether they're in their recoveries or actually in the grips of their trauma and their addiction. So let's back up a little bit and first talk about the paradigms of treatment of trauma and addiction. And I think everybody out there knows that, there have been times when people believe that you never touch the trauma until a person had X amount of months or perhaps even a couple of years in sobriety. But this is often proves unrealistic because the symptoms and unresolved conflicts of the trauma is often what drove the addiction in the first place as a means to escape or to regulate feelings. And it just proves too difficult for them to manage, and often they lose their sobrieties after a brief time. Then the other side of it was to focus on the trauma and in hopes perhaps of relieving the effects of the trauma, the symptoms of the trauma, that then the substance abuse would magically wane in its force, and then they would be better that way. And doesn't really always work. So today's paradigm is of treating these things concurrently. I would say that Seeking Safety is one evidence-based curriculum that's very popular and in use, where people are receiving education about addiction, but also about their trauma side by side, and the clients are developing an understanding of how staying safe in the world helps on both accounts. And of course they learn that one of the very worst things in the world they can do to reactivate their trauma is to start using again. So So we do offer Seeking Safety here, and with all of our clients, we do approach the trauma and the addiction concurrently. At PHP and IOP levels of care, we're kind of the MASH unit and a little bit beyond that. And really what's on the front burner is getting their substance abuse and addiction under control. However, we provide psychoeducation and coaching and some encouragement, the development of simple coping skills based on these understandings to help them relate their trauma to their substance abuse and to come out of here with some sense of how to cope better. The algorithm is something we've developed here to help them do that. And what we say to them is this: those who build a self-care routine to help them stay sober a day at a time are actually doing many of the very same things that people need to do to cope with their trauma better and to stay more regulated and to feel safer. So in a way, what we're saying is, in a way, that you can, by staying sober a day at a time and applying these principles of self-care, which apply across domains, you actually are healing from your trauma without necessarily having to talk about it. What's most important is that you know what trauma is in the broadest sense, that what its effects are on human beings. There's many ways to get traumatized, but how human beings respond to trauma fall along a narrower band, and so people that are in a room, as long as they're talking about the effects of trauma and how they struggle with the effects of trauma, are much more on the same page than if they were talking about their stories. So the common denominator is how trauma affects all human beings. But we certainly do not want to get into what I would call abreactive work, or that is work that dredges up the feelings of the trauma and get people significantly dysregulated, because then they're more apt to use. And that's only one way some of our folks put themselves in the path of self-harm. So So here's how we go about it. So I have a page here, and I'll hold this up to the camera. It's probably not clearly visible, but on one side is what I call trauma and addiction, active behavior and thinking. And then on this side of the page is recovery, active thinking and behaving. And the line down the middle can just represent stuff that happens to everybody all the time out there in the world. And because the world and events that happen are what trigger our reactions or elicit our reactions. And it's really a matter of how you deal with those things. So at the very top, what we tell clients is if you are reacting to situations, then you are much more apt to be, if not fully in the grip of, a trauma reaction or your addiction. So reaction, would be losing your temper, having a big running away. I mean, there's a lot of ways that we react, but reacting though reflects running away from a feeling, whereas responding, which is over here, reflects something that's more thoughtful. It's engaging the rational brain, whereas reacting is just your emotional reaction. So, are you reacting or are you responding? And that's something we hear in the hallways all the time with clients speaking to each other. Dude, why are you reacting? You should be responding. Where's your thought process here? And we're trying to get clients to not abandon, to engage their rational process as much as they can. And there's a difference. If you're thinking something through, then you're in your recovery. If you're not, if you're just reacting, then you're in your addiction or your trauma. So the next thing on here would be survival versus coping behavior. Many of our clients, will refer back to an age when they were first traumatized. Could be 8, 9, I don't know, let's pick 9 as an age. What did they do to survive back then? And could be running away, could be hiding, it could be acting out in some fashion. But the surviving behavior helped survive back then, but as adults, it very often works across purposes. And we want clients to not think about surviving so much as about coping, because whereas for the 9-year-old it worked to help them survive and self-preserve, when you're a 40 or 50-year-old in recovery, running away and getting in fights or acting out sexually or with your substance abuse, all these survival behaviors are actually working at cross purposes. They keep you in your trauma and they keep you in your addiction. So we're always encouraging clients to reflect, are you surviving or are you coping? Coping is about self-care. Surviving is about just being in your trauma and doing whatever you need to do in the moment to not feel, to escape that situation. Similarly, we talk about the difference between comfort and relief versus safety. We've asked clients many times to describe to us a safe place, and many will describe something that's not safe but comfortable. Might be on their couch playing video games or hanging out with their friends on a street corner or some other familiar place. And hanging out with our friends that use being on the streets, being isolated alone at home is perfectly comfortable, but you're by yourself, and it's really not a safe place in respect to your addiction and also your trauma. We tell clients all the time that when that baby gazelle gets separated from the herd, that's when the cheetah comes out and smokes it. And addiction is the same way. You need to be embedded in your herd, and therefore, safety is about being connected, but it's often not comfortable. And there's a bit of a conflict of interest there. So we're encouraging clients to understand that being safe is not always comfortable. Many of them would rather take a stick in the eye than go to a meeting, but that's where the safety is. That's their herd, and they need to be embedded in the middle of it. So the next thing here would be, isolation, connection, and belonging. An environment of one person is the most non-threatening environment I think you can imagine, and I guess all you're alone with are your thoughts, which can be negative, but the addiction does definitely prey on those who are isolated and alone. Our thoughts becomes recursive, and there's no one to give us feedback or call us on a bullshit. there's just many things that are dangerous about it. And connection and belonging is really what human beings seek in their deepest hearts of hearts. But for those of us with trauma, who've been hurt by the people upon whom we placed our greatest trust, those are the ones who hurt us so. We're going to have a deep and profound ambivalence about being connected. But even so, we want to push people towards connection out of isolation, because that's where recovery is, and that's where healing is, and that's the direction we want to go. Is it easy? No, but it's vital. Broadly speaking, we want to talk about is what you're doing and how you're taking care of yourself harmful, or is it reflect self-care? Now, a lot can go in here. When I talk to clients about self-care versus self-harm, I want them to think about two environments. One is the external environment, and one is the internal. And then, of course, the behaviors that they might engage in. So self-harm would include some stereotypical things like cutting, and or it might include something like entertaining negative thoughts. It could involve letting yourself act out with angry behavior. Some clients, especially the younger clients, really are into their power struggles and their arguments and feel they have to win every point. And I point out to them every time that that's really self-harm. So the self-harm can be a lot of different things. Your thoughts, your feelings, your behaviors can also be who you hang out with and what you're doing out there in the world, and are you doing what you can to stay safe. And then there's the internal world. So the other way we talk about this is who's in charge of your brain. Some clients, when they're in a trauma reaction, are thinking and talking and presenting almost as if they were 9 years old. Not like they were 9, but as if they were, with many of the signature kind of statements that a 9-year-old would be, you expect developmentally for a 9-year-old. And the problem is that the 9-year-old really doesn't know how to handle all this other grown-up stuff. And when the 9-year-old is in charge, it's often very feelings-driven and very behavioral and very running towards self-harm or survival kind of behaviors rather than coping. And what we tell clients quite often is if the worst feelings you're having, your big fear, you want to run, you want to pick up, you're feeling out of control, that very often that's the feelings that you had way back then when you were 9, visiting you today, and that is how your kid felt. And although you may not remember, now you see. And so what we encourage clients to do is to think about who's in charge of the show right now, and not to sound too, psychobabbly here, but we often encourage clients to parent that kid, knowing that when you can be compassionate and reassuring and firm and loving and set limits with any child, that they generally feel safer and they calm down and their behaviors and their feelings calm down. And the same is true for the kid inside of us. So we want our clients to not let the kid run the show, but to invoke their self-care and their rational brain and their mature self and tell that kid this is going to be okay. And they're not going to let any harm come to them. They're not going to abandon them. And just, it's going to be okay. And universally, the reaction we get is, I'm not going to sit there and talk to myself. People think I'm crazy. And it's like, oh, come on now. It's really, how you talk to yourself on the inside. It's learning to manage your thoughts and feelings in a more adult way, but it involves recognizing the panic and the terror and the helplessness of the kid on the inside of you, which drives so much of this crazy behavior. Lastly, we've talked about it a little bit, just how you manage your thoughts and feelings. A lot goes into this in the groups and the therapies we do. A lot of clients will do something that I call feeding the monster, which is they'll have negative thoughts, and they'll just hold on to them and they'll wallow in them and stew on them and amplify them, and have this idea that because they feel this feeling that they have to feel it, and aren't able to reframe it or think it through with realistic thinking, or apply kind of a grown-up kind of an angle to it, and they get so wrapped up in the feelings that they end up using over it. So we're asking clients to ask themselves, are you indulging in these feelings? Are you feeding the monster here? What are you trying to do to take better care of your thoughts and feelings? Some will say that I like it when I'm angry. I feel powerful and I can get back at people, or it just feels kind of satisfying to go off on someone. But it's not self-care, it's self-harm. And in the end, you are the one who pay the price for that. And everybody admits that sooner or later, no matter how stubborn they are. So we have a lot of little tricks of the trade we use here. One I call catch and kill, where a client will identify a very common negative thought that they have, and they're going to catch it. So one client I had today was talking about, nobody likes me, and I don't belong. And that's not the kind of feelings and thoughts that a 9-year-old who's been picked on in the schoolyard would have. I don't know what is, but he has to identify that and catch it, and then he has to kill it by reframing it in some way. I know you felt this way before, and it was very painful, but just because you felt that way then doesn't mean it's true now. You have to reframe it in some mature, realistic way. And then they might follow it up with some kind of a script, which is to the effect of, it kind of realistically captures the situation in life right now, but maintains some of the hope that is realistic if they stay sober a day at a time. So catch, kill, and then repeating the script, So at the very bottom of this list, of course, is the biggest one of all. Are you using or are you staying clean? Because even, what I would say is that any one of these more minor ones begins a domino effect that ends up with us using, and then all is lost. At least in that moment, you got to rebuild again from the point of using. But as long as you're clean, there's always hope. And you are not only hoping for a better life, but you're also healing from your trauma. Because the most damaging thing you can do is to use. So clients use this to assess themselves. If they identify one or another of these that they're doing, they realize that they're on the wrong side and they try and get over on the right side of it. And here's how clients are kind of self-assessing in this kind of algorithmic way, how they're doing in respect to managing their trauma and their addiction. So, invite your comments, and good to talk with you. Thank you very much.